The age group that we're talking about when we're really thinking about prepubescent acne would be anywhere from, say, as young as 6 or 7 years old until about 11 or 12 years old. We're actually seeing prepubescent acne occurring more frequently at an earlier age. Young girls are going or entering puberty at least 1 to 2 years earlier than they did, say, 20 or 30 years ago. So we see it more commonly in young girls than in young boys. And this probably relates to the adrenal glands, which sit just above our kidneys, getting into action a little bit earlier on, releasing small amounts of hormone. There are many myths out there. For example, the idea that acne indicates that the patient is dirty or unhygienic in any way, isn't washing their face enough, or is consuming all the wrong foods. What we know is that acne is a very genetically determined condition. I think the first signs that people will notice is a slight change in the texture of the skin, and the forehead is probably the most common site affected. You might notice just little bumps appearing that weren't there before. They can be skin coloured, or on the more severe end of the spectrum, they may actually be inflamed. We call these papules as dermatologists, and that just means red spots or blemishes. And that's the sign that the immune system has come in and is starting to attack the oil glands that are working in over time. The skin might just seem a bit oilier or a bit shinier as well. When prepubescent acne is missed and is allowed to progress into full-blown teenage acne, or even acne that persists in the 20s and 30s, there's a much higher risk of scarring. So what we really want to do is recognise it early and get the appropriate treatment for that patient at an earlier age. There are certain ingredients that we look for as dermatologists that we know have been proven to help with acne. And certainly the first one of these are to do with unblocking these blocked oil glands. We call them keratolytics. And they include ingredients such as alpha hydroxy acids, AHAs, and beta hydroxy acids, or BHAs. And salicylic acid is probably the most common BHA that we know. Moisturising is important in acne. It's also known as what's called a skin barrier problem. So we don't want to overly dry the skin either through use of harsh cleansers or harsh topical therapies. But if the problem persists, it's about actually seeking help from a general practitioner or a specialist dermatologist with regards to prescription medications. And these can be in the form of cream. So you don't always need to go on tablets or other intensive therapies. Young people more and more are looking at themselves on their screens, engaging with young people via various media, and we're seeing that they actually really care about the blemishes that they're now starting to appear. And it's about normalising these changes, acknowledge that what they're going through is really common and that there are many things that can be done to help them and give them some hope.
And how do you stop the kids picking?
It's an absolutely age-old question. How do we stop it? Fidget spinners, I believe, is one of the new age ways of keeping someone's hands busy. But just encouraging them to keep the hands away from their face. Keeping them clean is really important, and maintaining a good skincare regimen.